now. Let me just start.
Okay, thanks. Hello, I'm Dr. Veronica Loy from Loyola University Medical Center. I wanted to thank the American Liver Foundation for the opportunity to talk to you about this very important topic of how to manage your liver health with physical fitness. In this webinar, you will learn why physical fitness is so important for your liver health. You should understand what lifestyle changes can help your liver. And I will give you tips to increase activity and decrease your sedentary lifestyle. Obesity is now the leading cause of liver disease in the United States. No matter what your cause of liver disease, fatty liver will make it worse. This will increase risk of developing cancer. Obesity decreases the efficacy of treatment for hepatitis C. If you were to require a liver transplant, obesity increases the complications after liver transplantation. Obesity increases the risk for diabetes, hypertension, heart disease, and arthritis. A loss of about 7% of your body weight can improve intrahepatic fat. Decreasing that belly fat or visceral fat right in the center of your abdomen will increase fat oxidation and decrease insulin resistance, regardless of your overall body mass. So it's really important to focus on weight loss in the belly area. But the story doesn't end with obesity. Sarcopenia is the loss of muscle mass. This is a normal part of the aging process, but it's accelerated in people with liver disease. Loss of muscle mass, regardless of your body mass index, is sarcopenia. Sarcopenia will increase the risk of liver disease, advancement in any type of liver disease, but particularly in people with fatty liver disease. So why is skeletal muscle so important? We know that the risk of chronic liver disease increases with a sedentary lifestyle, but decreases with physical activity. Why is this? Well, muscle is actually an endocrine organ. Muscle secretes cytokines and peptides we call myokines. Activity decreases inflammatory myokines, but a sedentary lifestyle will increase pro-inflammatory cytokines such as leptin and IL-6, amongst others. Frailty is the loss of strength. People who have sarcopenia and the loss of muscle mass will become frail. There are many ways to assess frailty. Here I've shown you a 1 frailty score. This looks at weakness based on your grip strength, slowness, looking at how long it takes you to walk 15 feet, low levels of physical activity, exhaustion based on self-report of your endurance, and unintentional weight loss. What may resonate more for you is activities of daily living. Activities of daily living include bathing, dressing, grooming, mouth care, toileting, transferring, simple things like walking, climbing your stairs, or just eating. Instrumental daily living activities are a little more complex. Things like shopping, cooking, managing your own medications, knowing how to use your phone to look up numbers, doing your own housework, laundry, driving or using public transportation, and even managing your own finances. We know as people lose independence in these activities of daily living, their quality of life is significantly impacted. How does frailty fit into all of this? Well, as someone becomes more frail, they have a higher risk of reduction in independently performing their activities of daily living by 20% or more. It should be no surprise that frail people with liver disease have a higher rate of depression regardless of their degree of liver disease. When people are unable to independently care for themselves, they feel depressed. This may mean you have a very severe liver disease, but if you keep your physical strength, you'll feel physically better. as opposed to someone with maybe a mild liver disease that's already lost their skeletal muscle and physical strength. They will feel worse and have a worse quality of life. This is really the same point here, that frail people with liver disease have a significantly lower quality of life, regardless of their MELD score or severity of their liver disease. Frail people are more likely to die if waiting for a liver transplant than a strong person. And if you were to go on to have a transplant, frail people have worse outcomes, longer hospital stays, more infections, overall worse outcomes the first few years after transplant, as opposed to people who stay physically fit. Finally, bone disease is quite common in people with chronic liver disease. The prevalence of osteoporosis is as high as 40%. This is even higher in certain types of liver disease. How do you manage bone disease and liver disease? Well, calcium supplementation, but maybe even more importantly, exercise and nutrition. So hopefully by now I've given you a lot of reasons to care about the physical fitness and how this may improve your liver health. Let's talk about how to do this. Aerobic exercise is recommended 150 minutes per week. This sounds like a lot, but really it's about 30 minutes of moderate intensity activity 5 days a week. Muscle strengthening exercises are also recommended about 2 days a week. If you're able to do these things, it will improve your quality of life and energy. You'll have a reduction in that central obesity or belly fat we were discussing earlier. This will reduce inflammation in the liver, reduce your risk for decompensation of your liver disease, and it might even reduce the risk of liver cancer. Let's talk about some tips to reach your goals. You really need to find an exercise that works for you individually. If you're a social person, you may like group exercise, like a walking club, or maybe a basketball league. If you're more independent, perhaps you'd like to go for a swim or try jogging. It's important to set a goal that you can achieve. Our bodies love to achieve goals. It releases endorphins as a positive feedback. So if you're not exercising at all now, you may want to set your goals a little lower. And as you achieve them, continue to set the bar higher and higher. Make it a habit. This takes some time, but consistency is key, so you really need to stick to it. At first, that will be challenging. It's best to find a time of day and consistently do it at the same time every day, and build this into your lifestyle. Eventually, it'll be just like brushing your teeth. If you're not a morning person, don't expect yourself to get out of bed an hour early to exercise. If you have a very physical job, you may not be able to count on the fact that you'll exercise at the end of the day when you get home. Find what works for you and stick to it. It's okay to break up your exercise in several short intervals, maybe 10 minutes in the morning, 10 minutes at lunch, 10 minutes in the evening. Whatever works for you, just make sure you do it. And don't quit. Another important point is to reduce your sedentary time. We sit in our chairs and lay in our beds up to 20 hours a day. We really need to work on getting up and moving. If we do this, insulin resistance will go down regardless of your body weight. So again, it really comes into that muscle strength and energy that you're creating. Some tips to reduce your sedentary time. Maybe take the stairs instead of an elevator. Deliver a message in person instead of email or by the phone. I think you'll find this improves communication and relationships as well. Park as far as you can from your office or the supermarket. This will require you to walk to and from the building. When you're walking, increase your pace. At home, maybe you can go for a walk after dinner. If you normally watch TV in the evening, use the commercial breaks as a reason to get up, stretch, walk, anything. Just get off the couch. This is very important. Some people may choose to stand while they're eating or use an exercise ball at the office or at home when you're working on a desk. All of these things will engage your muscles. The American Liver Foundation offers several programs. One is this Get Fit campaign, which has just started to help you in your office and workplace work on wellness. There's also the Liver Life Challenge, and this allows you the opportunity to meet other people who have an interest in liver disease, socialize with them, but also train for an exciting event like the marathon or some shorter walks and races. There is Liver Life Walks in all parts of the country, so check out the ALF's website for opportunities near you. The 10,000 Step a Day program has a challenge that's been receiving a lot of public attention. This is where you really try to wear a pedometer and walk up to 10,000 steps in one day. This is pretty hard to achieve, so you should start slow and really increase your steps by about 500 steps per week. Many of us here at Loyola have a challenge going on. We really try to outdo each other, and that makes it fun. But don't make this your only form of exercise. Studies show that people who exercise outside of work, outside of their daily activities, achieve better fitness. Don't count on just your stressful job or stressful life as being enough. I have many patients tell me, I walk a lot at home doing housework, or my job is very physical, I need to load trucks at work. But this is not the same as dedicating time for your own physical wellness. Talking about physical fitness really wouldn't be complete unless we addressed briefly nutrition. You really have to balance the effort of your physical activity as well as what you're putting in your body. You want to minimize sugar and salt. Eat lean meats and fish. And try to stick to whole grains. Some things that are particularly toxic to the liver are high fructose corn syrup. This is your regular soda, your regular pop. Drinking this will increase your risk of fat in the liver by 3.2 per 7 cans of soda that you drink per week. Central obesity will increase that risk of progression of all types of liver disease, so I recommend stop drinking pop. But don't worry, if you need that caffeine fix, coffee is actually good for the liver. This improves your liver enzymes in a dose-dependent manner up to 3 to 4 cups of coffee a day. This is black coffee. Please do not add sugar and creamer to your coffee. This will kind of defeat the purpose of getting that antioxidant property of coffee. Chronic liver disease has been shown to decrease risk of cirrhosis when people drink coffee. And people who already have cirrhosis have a lower mortality rate and a lower rate of developing liver cancer. We know people with hepatitis C have an improved response to treatment if they drink coffee. And coffee consumption was inversely related to the severity of that fatty liver disease, or NASH. So drink all the coffee you like. Alcohol is something we also need to consider when we're thinking about physical fitness and health to the liver. But how much is really too much alcohol? Well, that depends on who you are. What's your gender? Do you have coexisting liver disease? Genetic factors? How much is too much for someone without liver disease? Well, reportedly, men who drink more between 40 and 80 grams per day are at a threshold that they could be causing liver problems. And women, 20 to 40 grams per day, although the threshold may be lower than this. What does that really mean? Well, generally, I think of one drink being around 10 to 12 grams of alcohol. But that's really not fair because it depends on what you're drinking. I have many patients who think if they're not drinking hard alcohol or hard liquor, they're not drinking alcohol. But actually, it just depends on the content of alcohol in your beverage and the amount you're drinking. For example, this 24-ounce can of a lighter alcohol content beer has the same amount of alcohol as one higher content alcohol beer, both of which can be considered about 2 drinks. If you're thinking about wine, one standard drink of wine should be 4 to 6 ounces. Most people pour themselves about double that in one wine glass. You really have to think about what you're putting in your body when you think, how much alcohol are you drinking? If you have a problem with your liver, any amount of alcohol is too much. Alcohol will increase the risk of fibrosis progression and development of cirrhosis significantly, even if your liver disease is not caused by alcohol. I recommend if you have a problem with your liver, you should not drink alcohol at all. In summary, I hope you've learned that muscle strength and fitness will reduce your risk of worsening liver disease regardless of your body mass. You should be exercising 30 minutes a day, 5 days a week with a moderate intensity. Find an exercise that works for you and stick to it.